Morning folks, as David said, my name's Abigail Barbour. I am here officially representing the Met Office as a self-proclaimed weather geek. So it's probably a nice place to come in the day after Joanne's presentation about innovative use of technology, and then her last slide with two people with their anoraks on. Very appropriate timing. Hands up please if you've heard of the Met Office. Okay, keep your hand up or put it up again if you've heard of our work within the field of health. Oh gosh, I'll not tell my boss that, okay, so the minority of people. Okay, let's get started. This is our Met Office HQ, very impressive building back in Devon. And I'll tell you a little bit about what we do. We are the National Met Centre for the UK. Our responsibilities are primarily around the shores of the UK, but also abroad. And we have the Hadley Centre, that's the UK Centre for Predicting Climate Change and Climate Change Research. Okay. Our primary role is that of a public information provider. We are the National Severe Weather Warning Service. Now that came to fruition after the alleged hurricane of 1987. Anyone remember that? We'll not dwell on that slide. We're also a hurricane forecasting centre, despite the fact that they don't affect us here in the UK. We work very closely with our colleagues over in America to help predict where the hurricanes, both there and elsewhere in the world, will land. And we've got a pretty good track record of doing that. So we work in conjunction across the globe to ease that problem. Environmental monitoring, primarily work with DEFRA and the Environment Agency, doing things like trying to predict where the weather patterns will spread things like foot and mouth, or indeed working backwards to try and see where the problems stem from. Also flood forecasting, working with the Environmental Agency on that one, trying to predict how much rain will fall out of the sky and what that will do to the floods on the surface. Transport, working with both rail and road to try and keep our roads operable. Not all councils take our information. This is a highly competitive sector. There are a lot of private firms out there competing for the business. But we work with perhaps 50% or so of the councils across the UK to try and keep the roads moving. In the air, you can imagine this has been a tricky one at the moment with the ash floating around. We're one of only two world area forecast centres. There's us and the Americans. Basically, we try and look after all the meteorology at 30,000 feet or cruising height. And as I say, we look after half the globe, and in case Americans are having an off day, we have to be ready to look after the entire globe. We're also actually part of the MOD. We have a military arm whereby members of the Met Office go anywhere that the RAF go. We've got staff out in Afghanistan at the moment, basically trying to keep operations moving and keep the people safe. Okay, so where do we get it from? It's probably a belief that we look at what the seaweed's doing or what the fir cone's up to. And as well as that, I have to say, there is one of those back in the office. This is where we get our data from. So heavily reliant these days upon satellite imagery, upon what we can get back from aircraft. Again, a bit of an irony at the moment. Good old-fashioned radio sound balloons being launched up through the atmosphere so we can see what's going on above our head. Then at ground level, we've got buoys floating about in the seas. We've got fixed observations from oil rigs. We've got commercial shipping reporting back to us. And in the bottom right-hand side of the screen, we've got manned observations. And that really is the key to any weather forecast, being able to know what's going on now at this precise moment in time all across the globe. And it's all numerically driven. We have a huge investment in our numerical weather prediction model, and this is how we operate. We look at the UK on a 4-kilometre grid scale and up through the atmosphere. With investment, we want to get that down to 1 kilometre. So at the moment, our model can't differentiate between one village and something else less than 4 kilometres away. And we all know wherever we live, if there's a valley, if there's a hill, if there's fields, if there's urban areas, locality and location is very important to weather forecasting. So the more investment we can put into our model, hopefully the more accurate our forecasts will be. But I've moved sideways from becoming a weather geek, and I'm now helping the Met Office develop their understanding of how the weather affects the population and our health. So some of you might be aware of our heatwave service. It might seem like a dim and distant memory, but actually last June we did have a heatwave for the first half of the month. So we look at the weather patterns and we try and warn the NHS whether or not that's going to happen. Likewise with the cold weather patterns in the winter and a UV service. But what what we're primarily looking at on a PCT level these days are specific services for specific conditions. The top one, Healthy Outlook, is purely for people with COPD, which I'll talk about later. Brighter Outlook is still in its trial stages. That's for people with SAD. And then still under research is a demand forecasting model, trying to take all weather conditions into accord and help the NHS predict what demand that's going to see on their systems. Okay, so we'll concentrate on Healthy Outlook, our service for patients with COPD. What actually is it? Well, it's very simple. It uses a landline, or we can use your mobile if that's more appropriate. And we warn patients when, and only when, the weather conditions and virus loads will combine to put them at greater risk of having an exacerbation. The thought process there being that if we can warn them perhaps a fortnight in advance of these conditions occurring, they can take simple self-care measurements to keep themselves well, prevent themselves going into hospital unnecessarily. So we do that by a weekly forecast of risk for the patients out to every PCT. And we've got about 30 PCTs on board now and about 40,000 patients using the system. An automated alert out to the landline or to the telephone when these conditions combine, and a patient pack, as we have here. The patient pack gives them more information about their condition and what the weather will do to them, and it has some thermometers to help them monitor their living space as well. Probably the second most important is the last bullet point there, is the feedback to the patient's GP practice. They go online, they log in, and they see the results of those calls. Who didn't answer? And we have 3 consecutive daily attempts at trying to contact the patients. Who said that they're feeling worse than normal? Who said that they need a repeat prescription? And let the care staff go in and deal with what those patients have said. Okay, so hands up who felt it a bit nippy this winter? Yeah? Lots of snow, lots of ice, lots of frost. In fact, it's May and we're still having frost. It was -4 up in the far north of Scotland overnight. This slide is slightly out of date as we're still adding up the data for this winter, but this shows how much colder last winter was to the norm, up to 2.5 degrees colder than the 30-year average. So that's pretty significant. And the winter just passed was one of the coldest in over 30 years, so even worse than the previous winter. And this is what we're studying back in the Met Office. This is what we're looking out for. The high-risk areas. It's a battleground over the UK, which air mass is going to predominate and what our weather is going to do accordingly. But the blue and the red arrows are the ones that we're looking out for when we're monitoring the health of patients with COPD. We're looking for extremely cold or extremely hot weather. We're looking for air masses that come with a lot of matter in them. And we're combining that to what the virus levels around the UK are doing at any one point in time. So those things have got to combine before we will alert the patients of something being more dangerous than normal.